Welcome to the Surviving to Thriving podcast, where we're dedicated to helping you break free from chronic inflammation and get your life back. I'm Dr. Rachel Yeager, naturopathic doctor and medical intuitive, and the founder of the Surviving to Thriving method of chronic illness recovery. Join me as we uncover strategies for overcoming health challenges and restoring your physical, mental, emotional, and soul health. Together, let's embark on a journey to thriving. One of the things I love is that I have so much in common with the people that I work with. And part of that is because I have intentionally created a space where I feel like it's the kind of support that I feel like I needed. And I do think that there is an underlying theme to the experience with the conventional medical system. If you can hear my dog in the background right now, my puppy Curly is jumping around. And so, when I was really sick, I felt like everything that was being suggested felt very sterile, very clinical. The rooms were very white walls. And I had this buzzing feeling that everything I was doing it was kind of uneasy, like kind of jarring feeling. I know now that was my intuition. I didn't know at the time, and I definitely did not heed it. And now knowing that I have this intuitive sense to tap into, we all do. And we can kind of get a yes or a no on is something a good idea. And now when I work with people, I want to make sure that what we're doing feels good on a gut level, because if it's not going to be healing. It's going to be forced. It's going to be working uphill. And so I always ask people, how are you feeling about this? Do you feel drawn to one way or the other? Because that's exactly what I wish that someone had asked me. And every time I might outline different options or recommend something, I'm explaining what exactly it's doing, what my reasoning is, and why. Because that's what I needed to know so that my nervous system could process and make an informed decision. If someone's just telling you what to do, you have no idea what to expect, what that thing's doing, why. And so it's a whole different nervous system processing process. And it can lead to that uneasy feeling or feeling like you're not really guiding the raft the way you want to be, the way you want it to be happening. I also know now, which I didn't know previously, that I'm a very highly sensitive person. So not only do I feel things really strongly, I pick up on things, I would consider myself to be empathetic. My body is also more sensitive than maybe the average person's. So if there's a side effect for a medication, I feel like I'm more likely to experience it even at a low dose of the medication. And so it's really hard to be a sensitive person and just, be trying to be pushed and slotted into an existing algorithm in the medical system, because that algorithm does not account for sensitivity. I can tell you that from the side of a patient and now from the side of a doctor. And so that's why individual care and someone being able to take the time to really get to know your health is so important. I remember at my doctor appointments, I would be trying to remind them, hey, I previously had this reaction to this, or hey, like I tend to get this symptom, things like that. And I knew I was just a number, which isn't at all my doctor's fault. It's a byproduct of the healthcare system that we're in. I knew that they didn't have a really familiar grasp with me and my health and how I reacted to things, and they weren't going to remember. So I was always having to remind them, and that put extra patient burden on me because I felt like I had to constantly be advocating. And I think that advocation, that's always going to have to happen if you want the best healthcare outcomes. But I think there can still be a primary provider who's the glue, the center of everything, coordinating everything, who does tend to know your health the best. And they can guide you, okay, the allergist is probably going to recommend this because this is first line. And just remember that you are really, your stomach is so easily upset. So let's remember to remind them that, because this nasal spray that they're going to recommend, most likely, it frequently causes a little bit of stomach upset if you swallow it. So they won't tell you this, but it can be taken with food to help with that. Or you can tilt your head forward in this way so it doesn't get absorbed. Or you could ask for an alternative if it doesn't work. So it's nice to have someone who's the glue like that to coordinate between everything, especially people who've had any kind of past medical trauma, which is an unfortunate common byproduct of chronic illness because you've seen so many people, you've been put through the ringer, done so many tests, tried so many meds, had so many harmful side effects, had so many scary symptoms happen that you didn't know how serious it was and what it meant. So it's super common to have that. And so it's nice to be able to say, okay, if they're going to recommend this certain ultrasound, if that's too invasive, this is the alternative. Here's the pros and cons of doing the alternative instead of the first line recommended ultrasound imaging. So it's nice to just know your options, have the time to talk through these things, all the things I wish I had when I was first sick. And so I feel like it's really come full circle and I'm able to help be that support and provide that for people who are in a similar situation to what I was in. When I first got diagnosed with Crohn's and the arthritis and was having such severe symptoms, which I now know were mold toxicity and Lyme disease and a little bit of POTS and mast cell activation syndrome. At the time, just thought I had really severe autoimmunity. And a lot of times, people who have really severe autoimmunity, and it's not simply responding to the main medications, there's usually other things going on as well that are all contributing to that autoimmune picture. And I wish someone had said, here's the herbs you can use safely, and here's some alternative medication options that aren't going to have these side effects. And here's how to counter the increased cancer risk that's going to come with temporarily using this biologic as a band aid. And I just wish someone had laid everything out for me because I'm someone who, if given the resources, then I will use them and I will take the time to fully try to optimize everything in my health. I know some people would just rather take a pill. However, the people I work with tend to be highly sensitive or intuitive people and people who are really motivated for their health, people who would rather have all the information and all the options and then make their own decisions and really spend time, even if it's going to take an extra 10 minutes a day, to fully address all the parts of their health because that's what's going to optimize their health the most. So it's hard to find that kind of approach. It requires a really in-depth knowledge of the biochemistry and functioning of the body. You're not going to just follow an algorithm of this elevation on a lab means we do this med, or this symptom means this diagnosis, therefore this medication. If we're not going to do that and we're going to think about what does it truly mean for the body to have fatigue that shows up in this very particular pattern, or what does it mean if this one marker on a lab is elevated, this other one on a pairing lab is low, and this other one has been trending high. Together, what does that mean is happening in your cells, with your metabolism, with your biochemistry? So that's where functional medicine comes in. It's the function of the body, not an algorithm approach. But I will say what I do, I consider to be different than standard functional medicine. Because functional medicine, which is a certification that regular nurse practitioners or regular doctors can take to have a more holistic view of the body, it still focuses on what's wrong with the body. So it'll look at what's the driving the imbalance and what diseases or environmental exposures or infections could be triggering symptoms. And that's super helpful. And I do use all of that. But we also need to go from a wellness perspective of, yes, we need to address these negative barriers to healing. We also need to add in positive assists to healing. So, what are the lifestyle factors? What's the diet and nutrition that we can be doing? What are supplements that are going to build up and fortify our organs and our nerves, our brain, all the tissues in our body? And how can we not just kill any infection that might be there if we're having, interstitial cystitis, which is really often recurrent UTI, but how can we actually give the bladder supports to heal its lining so that it can repair itself? So it's really blending all of these things together, I think, has the best efficacy. It's the most likely to be successful. And the big part that I see left out of most protocols. So a lot of naturopathic doctors are focusing more on this wellness approach. A lot of functional doctors are still focusing more on this disease approach. Most people are not educated in the cell danger protocol, which is basically this new way that we can understand that the immune system responds to things and responds to threats. There are neat ways to evaluate for it, and it really explains what's going on with any kind of inflammatory response, period, and any kind of mast cell activation and sensitivity in the body. So that is a training I think that's going to be more and more widespread going forward. The other thing I think is missing is brain health. So if the body stays in a fight or flight state, it is really hard to heal because the body in a fight or flight state, when the brain puts everything on pause, that means your immune system is suppressed, your hormones are on the back burner, they're not being prioritized. Cellular healing is going to be really slow. Digestion is on pause, so you're not going to get the nutrients, and you're still eating, but your digestion isn't being prioritized, and that food's just going to sit and ferment and cause issues with dysbiosis, maybe SIBO, things in the stomach and in the intestines. And so if we have a very one-sided physical approach and we miss the brain, then we're going to be working uphill. It's like trying to walk up the hill with the lead weights attached to your ankles. You're physically providing these things to your body, but your brain is not in the space to allow your body to receive these things and initiate a healing response with them. And so if we can get both things on board, we can address stored emotions that might be trapped in the body. We can look at the health of the soul or the spirit and what are the things that we're doing to nourish ourselves. All of that together is what I think the true combination for healing is. I've tried all the things in isolation. In my 20 years with severe chronic illness, I have tried most things. First, as someone who was educated more like a health coach, and then now as a doctor, being a naturopathic physician, I've tried a lot of things, including ozone therapy and different things that are a little bit even more out there. And I really think it takes a combination of everything. And so blending all of that together, if you can find one person who provides that, it's really nice because then you don't have to be the coordinator. That person can be the coordinator. They understand the whole big picture. They can be the glue and they can guide you through all of these things in a nice stepwise function of, before we move on to this next physical step, it looks like this emotional piece is next, or it looks like this brain health piece is next. And there are ways that we can shift the brain out of fight or flight into a rest and healing state. Because we have to remember, fight or flight happens subconsciously. We're not choosing to do it. We don't even know what's happening. Our body is subconsciously going into a fight or flight state because of whatever is causing the inflammation. That threat in the body, your body's responding to it, even though you don't consciously necessarily know what that threat is and why you're having inflammation or that you're having inflammation. Your body knows and your brain knows, and it is responding. So tying all these things together, this is the way that I now practice. This is the doctor I wish I had when I was sick. And I form really deep relationships with the people I work with because I think that's really important. That's part of the healing. We need to spend time together. We need to be able to both fully be an expert on your health and what's happening so that we're not going to give you something that you're going to have a bad reaction to, or we're not going to push your body to detox something when actually your pathways aren't even open yet. So it takes a lot of time and it takes a little bit more, I would say, effort because it's not just taking a magic pill, a silver bullet, but it means we're truly getting to the root cause. And if you truly address the root cause when you do a healing approach, then you will actually have a much higher chance of staying fully permanently in remission or your symptoms completely going away, actually resolving the root of the cause. If we figure out why you're having headaches and we take care of that reason, instead of just giving you a nice tool to take every time you have headaches, we can do both. I don't want people suffering while we work on the root cause because that can be longer work together. So we could always use these, the least harmful possible aids to get some relief while we work on things. If we can actually take care of that reason instead of just suppressing symptoms, then we're truly healing. They're not just doing symptom suppression and Band-Aids. So everything, all types of medicine have a time and place. Symptom suppression does have a time and place. We need to be functional and feeling at least somewhat okay so that we can even do the steps to try to heal. So it's all about combining everything, blending everything, tailoring it to your preferences, and there not being any judgment or preference or bias on my part. We're just giving you the options so that you can choose. Do you want to just try to shift this with diet? Do you want to try to take a supplement? Do you want to learn more about the pharmaceutical options that might be a little more heavy handed, but give you more symptom relief while we work on things? There's no wrong way as long as it's tailored to you. So if you have any questions about this, definitely please reach out. I love to chat with people about what I do. I'm very passionate about it, especially since I've been on the other side in the patient chair myself. So definitely reach out, and I wish everyone healing, and I hope everyone has a great day. Thank you for tuning in to today's episode of the Surviving to Thriving podcast. I hope you found inspiration and valuable insights to support your journey towards better health and happiness. Remember, each health journey is unique. This podcast is not medical advice, and it's essential to consult with your healthcare provider before making any changes. If you'd like to schedule a complimentary consultation with me, I would love to talk with you. Please go to drrachelyager.com/schedule.